Hi, beautiful people. So I'm honored today to be with Dr. Jess, pelvic floor therapist. And today we're going to go over a few things in regards to the pelvic floor and why it's so important to pay extra attention to, possibly meet with a pelvic floor therapist if you can, whether you're pregnant, postpartum, or thinking about getting pregnant. I have a lot of patients coming in with a variety of different issues throughout pregnancy, whether it's before they are even getting pregnant, first trimester to postpartum, and beyond. So I'm so excited to be here, ask some crucial questions, and why it's so important to meet with a pelvic floor therapist while you're pregnant and any stage of life.
Hi everyone, my name is Dr. Jess. I'm a pelvic floor physical therapist and owner of Vibrant Coast Physical Therapy and Wellness. And I'm so excited to be here with Ginger. We work really well together as we both work with women throughout pregnancy, postpartum, and beyond.
My first question is I talk to a lot of patients about this, and I encourage them to go see a pelvic floor therapist when I first see them, whether I'm seeing them in their first trimester or even postpartum. But can you explain in your own words why it's so beneficial to work with a pelvic floor specialist in pregnancy and postpartum, and if you've never even been pregnant?
If you're pregnant or postpartum, it is so important to work with a pelvic floor therapist. I think many women think only if they're leaking or have symptoms they should go to pelvic floor therapy, but there's so much you can learn to prevent any symptoms in the future. So I work with women during pregnancy about building their strength and coordination with their pelvic floor, managing the pressure in their abdomen as their uterus is growing to help support your pelvic floor. I also work on birth preparation to help reduce the risk of tearing or prolapse during delivery. Most people think that your pelvic floor has to be strong to push your baby out, but it actually has to move out of the way. So we work a lot on how to learn how to do that for delivery. Postpartum, I suggest every person come in, whether you've had a C-section or vaginal delivery, to learn how to reconnect to your pelvic floor and your core.
So my specialty is gestational diabetes, and I work with a lot of amazing women that have gestational diabetes. And one of our biggest things is baby being too big, which can even happen when blood sugars are completely controlled, and we see that still baby has a bigger belly than head, and there's that possibility of ripping more during delivery. You know, someone's in their third trimester, they see the ultrasound, baby's looking big. What would be some key things you could kind of, like maybe 3 key things that you would go through with them to kind of assess them or get them going?
So there's a few things. The first, I teach everyone, but especially if your baby's bigger, it's really helpful, is each stage of labor, your pelvis opens with different leg positions. So there can be labor stalls if a baby is bigger, or just if your pelvis is not opening in certain ways. So I teach women how to move their legs to open the top, middle, and bottom of their pelvis during delivery. Yeah. And we work on mobility in third trimester to make sure your body can access those positions. And I teach women, it's called perineal massage. So teaching those tissues how to be okay with stretching, as a lot of times tearing during delivery is because the muscles tighten or spasm in reaction to the stretching versus just kind of leaning into the stretching. So I teach women how to do that, and breathing, breathing techniques too. Yeah.
So there's not only can you teach them how massage the area so it lengthens easier and gets out of the way, but then there's actual exercises and stretches that you can train them to do while they're in labor. That's crazy. Oh.
Yeah.
Awesome.
Yeah.
When ideally would you like to start seeing someone that's preparing to be pregnant or delivery? How many times can they expect to see you, and when's the best time to start? But is it ever too late to start?
Well, it's definitely never too late. I see people years after they've had their baby. But if you're really planning a pregnancy, I always recommend coming maybe once before pregnancy to just see where your pelvic floor is at and if there's anything to work on. But if you are pregnant and you don't have any symptoms, you just want preventative, I say during second trimester, we can get like a workout program going, teach you about your pelvic floor. And then during third trimester, doing more like birth prep. If you have no symptoms, even just coming up maybe 3 times during pregnancy, but if you have more symptoms, people come more frequently, more like physical therapy for maybe once a week down to once a month as we get symptoms under control.
Awesome. So assessing the pelvic floor is quite the intimate thing to assess. So what can they expect when you're first assessing them so they're kind of prepared or mentally? Because I don't know. I've never been assessed.
Yeah. So as long as you're comfortable and your OBGYN clears, it's a one gloved finger internally assessing each layer of the pelvic floor. So there's 3 layers. The first layer is more what you see towards the outside. And then up until that 3rd layer is like the pelvic bowl muscles. It's painless unless you're someone who experiences a lot of pelvic pain, much less than like a speculum or anything. Just assessing how the muscles activate and relax and see where your pelvic floor is at to see what you need to work on to prepare for delivery.
So are they doing like Kegels while you're like inspecting them? Is that how you do it?
So a Kegel is a pelvic floor activation.
Okay.
And then essentially like the opposite of a Kegel is the relaxation. So we want to make sure someone can activate their pelvic floor or do a Kegel to make sure their pelvic floor is strong and coordinated to support their growing baby, prevent leaking of urine or stool. But we also want to make sure it can relax because that's what allows you to deliver without tearing and to go to the bathroom. So if someone has a tight pelvic floor, they can be constipated too. We want to make sure they have both.
So you have the amazing Vibrant Strength app that you created, and I'm honored that I have a few talking points on there talking about some popular nutrition concerns. And in that app, can you kind of take through the different exercises someone can expect and experience to have if you download the app and are taken through by trimester different exercises?
Yeah. The Vibrant Strength app has both the Vibrant Pregnancy program and the Vibrant Mama program. So the Vibrant Pregnancy program has weekly workouts. There's 4 workouts every week of pregnancy from week 5 to week 40. In the first trimester, there's nausea-friendly workouts, and all the workouts have pelvic floor education. You warm up and cool down with pelvic floor exercises, and then the main part of the workouts are traditional strength training, but safe for pregnancy and with the intention that we're preventing pain. So I work with hundreds of women who experience pain during pregnancy, but we're essentially doing prehab to prevent this pain, create pelvic stability during pregnancy. And then the 3rd trimester workouts are birth prep. There's strength training, but then also birth prep mobility to prepare your pelvis for labor. And then the Vibrant Mama program, it starts with it's safe to do the first week postpartum, just like breath work, and then moves up to get you back to working out and then back to running and jumping.
So you said the word prehab. Can you describe to listeners what prehab means versus rehab?
Yeah, so prehab is an abbreviation. It's preventative rehabilitation. So we do that in sports with kids to prevent overuse injuries. We'll strength train the muscles that are important to prevent certain injuries. I kind of coined that term in regards to pregnancy because there are so many common pains like pubic symphysis pain or SI joint pain, back pain during pregnancy. So if we can strengthen your core and your hips and everything to stabilize your pelvis during pregnancy, then you can experience markedly less pain during pregnancy.
Outside of pregnancy, let's say, whether they're postpartum or someone's never been pregnant, what are the benefits of pelvic floor therapy? We think it's really common that someone sneezes and they pee themselves a little bit, but it's probably not. It's not. We're not supposed to be doing that, right? But we're kind of like just accept it as we get older, or for whatever reason.
I work with women 15 years after pregnancy, or people who never had children as well. So we all have pelvic floors, and it's in charge of our bowel, bladder, and sexual health. So people with like endometriosis or PCOS oftentimes have pelvic floor dysfunction, or if they have had a baby a long time ago. Also, menopause creates a lot of hormonal changes in the muscles in your pelvic floor. And so some women are totally fine their whole life, and then they hit menopause and they start leaking. I work with women really throughout the lifespan on preventing incontinence or heaviness, pain with intimacy, or any ab separation.
I saw my primary care doctor yesterday, and she said the word perimenopause, and I was like, but yeah, do you want to talk more about some of the hormone changes? Like, how does that affect like perimenopause, menopause? What are happening with the muscles at that time?
So during perimenopause and menopause, there's a decrease in estrogen in the muscles in your pelvic floor. Other places too, but specific to pelvic floor therapy. A decreased estrogen level in your pelvic floor can create weakness in your pelvic floor and just like a thinning of the tissues. So some women have more pain with intimacy because there's decreased lubrication, and then just weakness in the pelvic floor can create more symptoms. So maybe someone had a prolapse for a long time, but their muscles could compensate for that because they were strong. Then when they get weak through menopause, then they start to have symptoms.
You have all these amazing exercises in your app. If there were 2 exercises that you just kind of are amazing exercises, you feel like everyone should do them regularly, what would they be?
First one is kind of broad, but I start every workout, whether it be the pregnancy program, postpartum, or just like a general strength program. But it's truly just breath work. So it's practicing inhaling and relaxing your pelvic floor as you expand your rib cage 360 degrees. So you're inhaling and then exhaling and zipping up your core and lifting your pelvic floor. So I teach that in all different positions. So someone should be able to do that sitting, standing, hands and knees. So I'd say that's the number one. It's a great exercise during pregnancy because your belly actually creates like a resistance with that exhale to be an ab exercise. And then postpartum, it helps you reconnect to your core and pelvic floor. So that would be number one for sure. And then number 2 would be bear crawl holds. So on your hands and knees, and then you hover your knees. You can make it even harder with adding like a ball or a yoga block between your knees. But that exercise, I notice people really connect well to their pelvic floor and their core. It's an easier way to connect to your deep core, but then it's more challenging than just like the breath work.
Now let's talk constipation. As a dietitian, I also work in a gastroenterology office beyond my women's health work. And so I see a lot of people with different GI issues, whether it's gas, bloating, pain, constipation, diarrhea. Probably the number one I feel like is constipation for many different reasons. And so for constipation, if you have someone coming in, what's going through your mind?
So I also see a lot of patients with constipation, pregnancy, postpartum, and then beyond. The number one thing is I teach people how to have a bowel movement. Most people have been taught wrong and they tighten everything. But like I said earlier, to be able to evacuate your bowels, you need to be able to relax your pelvic floor. So I teach people how to inhale and relax their pelvic floor, essentially like blooming open, keeping it open, and then exhale as they bear down instead of holding their breath and straining. That actually closes the sphincters off when you're like holding your breath and can seem like you're constipated, but you're actually, it's just like the anatomy on how everything is working.
Oh,
so
interesting.
That is a huge game changer for people. They notice it like within the week of changes in constipation.
Blow out when they're pushing out? Okay.
Yeah. So never holding their breath, always exhaling as they go.
Okay.
The second thing is posture when they're going. So a lot of people like curl over, but sitting up tall and with a squatty potty, their knees higher than their hips is the posture to align everything the best. And then if someone's not pregnant, don't do this during pregnancy, but if they're not, there's a bowel massage that I teach people to help just like manually move things along. Yeah, so I would say those are the three things that can be really helpful, and then in conjunction with everything you get with diet.
Thank you. I know I finally bought a squatty potty this week. It's been on my list, and I was like, okay, like I've heard so much. I'm like, I can't, I need to actually like have one of these in my house. I think, but for a while I was like embarrassed to have one in my bathroom. I don't know. Yeah. It's silly things that we make up in our head. Through nutrition, it's like that combination of stuff, because I find a lot of patients are coming in constipated when they're not drinking enough water. Do you see that a lot? Like they're like drinking like 30 ounces a day and they weigh like 230 pounds. Well, that's not enough. Yeah. I mean, the rough estimate for hydration is half your body weight in ounces, but there's all kinds of different recommendations out there. Especially in pregnancy, I feel like women, they might just forget to drink water. There's so much going on, or there's less space for their stomach now, and they're getting acid reflux. So that's a big one. Also, the standard American diet has about 13 grams of fiber in it. Well, it's recommended that we have anywhere from 25 to 35 grams of fiber. So really focusing on those foods that are higher in fiber. I have my little like go-to calculation when it's like weeding out bread and crackers, tortillas, all that kind of stuff, is that I want to see at least 1 gram of fiber per 5 grams of carb in there. Otherwise, it's just a carb food that's not going to give you that fiber you need, and it's just going to shoot your blood sugar up. It's my other big thing I'm concerned about is blood sugars. And for some people, especially with my individuals with gestational diabetes, and they're trying to eat so much protein and fats, and sometimes we still can't get it, we'll do magnesium and psyllium before bed, and so with some water too. And then for those with irritable bowel syndrome, we would go through the elimination diet, and you're going to see what foods are triggering their constipation. Like I had to find out the hard way that I'm lactose intolerant, which is like the worst because there's no good cheese replacement. But yeah, there's a whole protocol to kind of go through for helping with constipation. But I find, a lot of people are really stressed out right now. I think it's great with the pelvic floor therapy because you're working on that breath too, and teaching them how to let go and relax, because a lot of us are just so tense these days for so many different reasons. So that's great.
Awesome. That's so helpful. I never knew the rule of like the 1 gram of fiber to 5 grams of carbs.
I made it up.
Okay, well, it's so helpful. Like I'll remember that in the grocery store now.
Yeah, it was just a way to weed things out. And I have no clinical research study on it, but it's just a helpful tool. We need more realistic tools, and that's kind of the hard thing with nutrition research too, is that it's hard to get good studies out there. I could talk an hour about that, but yeah, it's a good tangible tool that you can exactly take to the grocery store.
Yeah. Ginger, I know that you specialize in working with women with gestational diabetes, and I wanted to know just what are a few main things women can do to prevent gestational diabetes?
There's so many things that are involved with getting gestational diabetes. Sometimes it just happens because it's caused by the increase in hormones from the placenta. And so I tell people, even I might get gestational diabetes if I were pregnant, since I am well over the age of 25. But dietary-wise, there is some research to support following a Mediterranean-like diet can help reduce the risk of getting gestational diabetes up to 30%. And some of the key things with Mediterranean diet is focusing on those healthy fats from whole food sources, like extra virgin olive oil is your main cooking fat, having whole nuts or seeds every single day, and not doing too much processed meats, so not a lot of bacon, deli meat, and not overdoing it on red meat, which I know is kind of counter to what you hear about a lot of things with prenatal nutrition, and focusing on getting at least like 1 to 2 cups of vegetables At lunch and dinner, the more the better. And really just having your whole high fiber foods like beans, legumes, winter squash, peas, thinking of more whole food starches, and fish at least 2 times a week, if not more. There's some research to support having 12 ounces of fish a week can increase baby's IQ. So don't be afraid of fish. We're just wanting to eat smaller fish, not eating a bunch of ahi tuna and shark and things like that for mercury. And you can always check online to see what fish are smaller and have less mercury in it for pregnancy. So those would be kind of like my first go-to things with people when we're first meeting to focus on reducing their risk for gestational diabetes.
As many of you know, I work with women and more focus on exercise during pregnancy. How does exercise play a role if someone either preventing or if they have gestational diabetes, how that can help manage blood sugars? My question is more on walking and then resistance training.
Both have been shown to be beneficial. I encourage people to do a combination. I'll have clients where they'll do like 20 squats after a meal because they can't go on that walk, and they'll see a difference in their blood sugars. I really encourage pregnant people to walk after a meal. That's better, but any time is good if they can get it in. And I try to describe to them when we're eating, those carbs come in, break down into sugars. Depends on what the combination was in the meal, how high fiber, how much protein, how much healthy fat. But once there's sugar in the blood, when we're exercising, it's like a little sponge that soaks up the sugar. So kind of reduces that insulin resistance while you're exercising. So the more, the better.
I help women a lot early postpartum through, a year postpartum, but especially in those first 12 weeks postpartum when there's a lot of tissue healing going on. Do you have any recommendations in terms of tissue healing nutrition and or lactation support too? So I guess that's two separate questions, but maybe first tissue healing.
Yeah, so tissue healing for my client before they deliver, or if I don't get to catch them, then I talk with them postpartum. We'll go over certain foods that are good for tissue healing, hormone balance. Some of the key things we're looking for is, high in vitamin C foods. Could be berries, but also bell peppers, broccoli, things like that. Getting as much of those as you can because that helps with tissue repair and collagen production. Getting things in like bone broths or some collagen supplements too can be helpful. Really making sure you're meeting your protein goals still. A lot of moms forget to eat. You want a little over 1 gram per kilogram of body weight in protein postpartum, so that can really help. I recommend women before they deliver thinking about a lot of one-handed foods. But I'll recommend making a little mixture of nuts and seeds. So pumpkin seeds are high in zinc, sunflower seeds, Brazil nuts, almonds, making a mixture of those, also walnuts, and having them in little jars around where they think they might get stuck breastfeeding can really help making sure they're getting certain foods that are not only good for like thyroid and hormone balance, because about 23% of people could have some kind of like thyroid issue postpartum, even if you didn't have anything going on, but also that helps with your tissue repair again and all those kind of things. So those are kind of like the main things we'll go over to kind of set up a plan for postpartum for tissue healing and hormone repair. For lactation, there's certain herbs and foods that help increase milk production. So most popular is oatmeal and flax seeds. So I'll recommend doing just like oatmeal with some flax seeds. You can make the fancy lactation cookies. They're basically just like oatmeal cookies. Another popular one is brewer's yeast, or really anything with yeast in it. You can have non-alcoholic beer and people will swear that should actually help. some people will be like, oh, I have to drink beer and then I'll pump because I need to like increase my milk production, get the alcohol. Well, you can buy the non-alcoholic beer. You don't have to buy the alcoholic beer. And other things like chamomile, goat's rue, ginger. There's a certain tea called mother's milk tea that a lot of people will just get at like Target or most grocery stores. They have it, and that can really help. So having those little things throughout the day. But really, the number one is just having oatmeal with flax seeds in it.
Many postpartum moms go periods of time without eating just because they're so focused on taking care of their baby. Mm-hmm. Do you have any tips or ideas to minimize those blood sugar crashes? Or if they are having that time of not eating, what's like a good first snack to eat?
There's so many different things. Yeah, if they think their blood sugar is going down, grabbing like your banana or apple real quick, and just having those things readily available. I also am a huge fan of just like the Aussie Bites at Costco are, yes, in the perfect world, we're making our own things, but like those are really just like these nutrient dense. They're not low sugar, but you need, more energy with all that you're doing, and we're trying to prevent them from crashing. They have flax seeds, they have oats in it. So those are like a good like emergency backup if mom's just like has nothing prepared. Like you can just grab one. They're like this big and somehow fit so many calories and nutrients in there. So that's a good one. But I think the more that they can have things that are just around on the counter that's easy to find and see. I'm a big fan of the ready-made protein drinks. One, we need that kind of backup. And just making sure that there's, at least 20 to 30 grams of protein in the protein drink, just to kind of like, there's carbs in there and there's protein, and just kind of keep things a little bit stable. But yeah, it's kind of survival mode in those first 3 months, really. But yeah, I also recommend that when people are having, people in their life with amazing intentions reaching out, how can we help? How can we help? Give them a recipe and say, like, here, you want to visit the baby or you want to help, here's a recipe. I would really appreciate it if you could make it and bring it over in thinking exactly those one hand or like little muffins or something like that.
Thank you all for tuning in to Ginger and I talking about the benefits of pelvic floor therapy and nutrition during pregnancy and postpartum. Stay tuned for more videos and discussions between Ginger and I about nutrition during pregnancy and postpartum and fitness and pelvic floor health.
I appreciate all you tuning in and watching our discussion. Be sure to follow both of us on Instagram, and we'll tag our Instagrams below, or be sure to follow above and check out Dr. Jess's app to get, on-demand videos for nutrition and exercise.